Is it working yet? I think it's working. Hey, it's Chris Westfall coming to you live from Charleston, South Carolina. I'm a licensed agent in 47 different states, I believe it is. Tonight, I've got news about Medicare and Medicare Advantage that you probably have not seen yet. And I want to bring you some additional stories in their own words of people who've gone through the process of having their original Medicare taken away because they signed up for a Medicare Advantage plan. Full disclosure here, I don't represent all the plans available in the United States, nor would I ever want to. We're highly selective on the plans that we represent. We help with both Medicare Advantage plans and Medicare supplement plans, otherwise known as Medigap plans. And we do so from listening to our clients, finding out what's best for them, and then recommending a plan that we think might suit their needs just best. I've only been doing this for 29 years now, since 1994, originally licensed, but I kind of have an idea of what's going on right now. I want to share with you some things that come from the Office of Inspector General with regard to actual things that they've discovered with regard to Medicare Advantage. And after they did this report, it was quite alarming, so much so that there's so much interest in it that they decided that they would, in fact, also put out a video. Now, they're not real good at the government of putting out videos, God bless them, but they tried, and they put out this infographic kind of a video to let people know what they think about Medicare Advantage. And so I'll show you what their little clip is. It's not long, it's not that painful, but it seems like it works pretty well. Also, Dr. Phil is back on the stage. Dr. Phil sent me a notice that they were going to sue me a couple of years ago for showing what they were doing with regard to Medicare Advantage. And one of the defenses to that is, if you're telling the truth, it's a defense against slander. So I will share with you what Dr. Phil's up to now that we're in 2024 season coming up. Oh, what the heck? I'll just show it to you right now.
Trying to stay on a budget and finding it difficult? Are you putting off the health care you need to save money? Well, you're not alone. According to a recent study, about 50% of adults in the United States have trouble affording their health care and have put it off because of it, especially dental care. Now, for people with Medicare, it does not have to be this way. When it comes to healthcare costs, there's a popular way to get additional benefits and protect yourself from high out-of-pocket cost by switching to a Medicare Advantage plan. And today we're going to talk with licensed insurance agent Rhonda Abdallah about how you can find the coverage you need while limiting how much you could pay out of pocket each year. Rhonda, welcome.
Thank you for having me, Dr. Phil.
So could you tell our audience and viewers at home what a Medicare Advantage plan is and how it may help them actually save money each year?
Well, Medicare Advantage plans are an alternative to original Medicare. So they offer the same coverage as Medicare Parts A and B, plus additional benefits like dental, vision, or prescription drug coverage.
Speak on that, but I don't know that it needs to clarify because it's already a rule that Medicare Advantage plans must cover the same must provide at least the same benefits as original Medicare.
And that is exactly my point, that it's not a problem with rules, it's a problem with compliance and enforcement. In other words, the Medicare Advantage plans basically have been flouting their obligations under existing law without a new rule, correct?
Absolutely correct, yes.
And a new rule is only as good as their being willing to change their real-world practices and CMS enforce those obligations, which it has been failing to do, correct?
Correct, yes.
Medicare Advantage is the managed care option within the Medicare program. It's designed to provide efficient, high-quality care that improves patient health outcomes in a cost-efficient way. But a new report by the Department of Health and Human Services, Office of Inspector General, found that sometimes Medicare Advantage plans limited access to medically necessary services. To explain this report's findings, here is Rosemary Bartholomew.
In this report, we found that Medicare Advantage plans sometimes denied or delayed patients' access to care, even though the requests for services were medically necessary and met Medicare coverage rules. So in other words, the patients likely would have received approval if they had been enrolled in traditional Medicare rather than in Medicare Advantage.
These report findings are cause for concern for several reasons.
We have three main concerns about these denials for care that was medically necessary and that met Medicare coverage rules. First, these denials can cause delays or prevent patients from accessing needed health care. And that can be particularly harmful for patients who are critically ill and for whom any delay in care can cause negative health consequences. Second, these denials can cause some patients to pay out of pocket for services that are supposed to be covered by their Medicare benefits. And this can be particularly harmful for low-income patients and those who can't afford to pay for these services out of pocket. And third, these denials can cause an administrative burden for patients and providers who choose to appeal these denials. And even when denials are overturned upon appeal, we found that in some cases, going through the appeals process caused significant delays in patients' access to needed health care.
For more information, visit oig.hhs.gov/Medicare Advantage.
Imagine that, all the stuff I've been telling you. And now you have Senate hearings on it. You have the Office of Inspector General from Health and Human Services talking about the same thing. And last week, I talked about how much money agents have been making under the table, way more than just the double the commission that you would make on a new person to Medicare by shoving them onto enrolling them in a Medicare Advantage plan rather than putting them on a Medicare supplement plan, which I feel is a lot better. Not everybody can afford a Medicare supplement. I totally understand that. And that's why we offer both to people. But we try to do so after first listening to them because that's the most important thing, how to put them on the best possible care ever. Well, there's this thing going on right now. If you've not watched a TV anywhere, you see commercial after commercial, right? We all get that. But what I have a problem with are the things where they're putting on a fake commercial known as an advertorial, where they have either a celebrity like Dr. Phil paid for his endorsement. And now this year it says paid endorser down there. Didn't say that before. So good job there with the disclaimer. But you have a whole bunch of agents going on to local newscasts and paying them to make it look like they're endorsing that agent. This is happening a lot. It's not something I've ever done because when the news comes to interview me, they're asking my opinion as a Medicare expert, which has happened several times here in Charleston. We don't pay for the opportunity to get on there and pitch. But here's just one other interesting one. And the one part that I want you to pay attention to is where it was revealed in the Senate over and over and over again that the rule says you must get the same care on Medicare Advantage as you do on original Medicare. But that's not what happens. But you see in all these pitches, all these people say the same thing. Oh, it's exactly the same as Part A and Part B.
From CBS Colorado, this is Colorado Review. Now, here's your host.
Welcome to Colorado Review. I'm Tracy Dixon. The Medicare annual enrollment period for 2024 health insurance runs through December 7th. Joining me today to discuss the Elevate Medicare Advantage plan by Denver Health Medical Plans is Jim Moses. Thanks so much for being here.
Thank you for having me.
It's great to see you. So who's eligible to enroll during these dates?
So any individual that is over 65 or under 65 that has Medicare A and B and lives in our service area, which includes Denver, Adams, Jefferson, and Arapahoe County.
What are some of the features that you have with the Elevate Medicare Advantage plan?
So as a Medicare Advantage plan, we cover all the benefits of original Medicare covers, and we offer dental, vision, and hearing, as well as a fitness membership.
I went to Medicare Advantage so I could have silver sneakers and be able to exercise at my Y, but now I'm having a bad back problem. I've not had surgeries or anything like that. I need to go back to Medicare, but can I go back? What will happen? So please, please, please help me. Thank you.
So that's the guy saying that everything's the same as original Medicare. You know, you get all that stuff, but what you get with Medicare Advantage is the YMCA. You get a fitness membership, baby, and you get a free drug plan included in that. Yeah, fantastic. So I want to share with you today, let me put it next to me so you can see it a little bit better, some of the things that came out of the OIG study. And when I read this study first, I did not realize that they had a whole bunch of actual examples in the study of what was going on with people. And then they had their doctors review it. And the funny thing is that when they started, their doctors over at Health and Human Services, when they started asking these Medicare Advantage plans to justify what they'd done with these denials that they looked at, suddenly, miraculously, sometimes this happens like when the local news gets involved in a fraud thing going on with a local business, suddenly the Medicare Advantage companies saw the light and they reversed what was originally a denial. So at the end of the day, after they looked at thousands and thousands of these cases, when they put out the final report, that some of my friends on YouTube are only focused on what's in the black and white, what you fail to realize is, had you not read the report yourself, that when they overturned all of these decisions that they had made, they overturned them only because Health and Human Services asked Medicare Advantage for the purposes of this study, hey, can you back up this denial that you did for this person? And then they couldn't back it up, so they just went ahead and approved those. So they didn't go in the study as, not ultimately being approved. So what I want to share with you are, and I really need you to use your imagination here, because you're going to see facts and figures in black and white. You're going to see ink on a page, pixels on a screen. But what this represents is every single person that's in here, every story you're about to hear, these are real people's lives. And I want you to imagine when you're hearing the description of the medical things going on that are pending, imagine how you would feel if you were in their place, being denied these levels of care. And I think it's pretty impactful. So I wanted to share with you just a few, and there are hundreds and hundreds and hundreds of examples. Let's just look at this one. A 68-year-old who was a smoker and had a history of lung nodules. Now, lung nodules, for those not familiar, and I'm not a medical person, so I don't pretend to be. It could be cancer. It might not be cancer, but you don't know if it's cancer if you don't test for it, right? We've already gone into great detail on the myriad of differences between original Medicare, especially with a supplement, versus Medicare Advantage and how they treat cancer. It's a world of difference. It's totally black and white. So how do you prevent from even getting into that world? You just don't diagnose and don't find the cancer. What could possibly go wrong? On the right-hand side of these, you're going to see the cost, or the estimated cost. What would it have cost the Medicare Advantage plan to just simply pay for what this person was looking for? In this case, $154. So here's a story. 68-year-old who was a smoker and had lung nodules. Now he's a smoker. The denial cause was it required unnecessary documentation, applied the Medicare Advantage organization clinical criteria not covered in the Medicare coverage rules. So Medicare says, this is our criteria. The Medicare Advantage organization said, no, we want this criteria. So what happened? Medicare Advantage organization requested unnecessary additional medical records to support the scan. All he wanted was a chest CT. He just wanted a chest CT to look at if this cancer had metastasized. So the Medicare Advantage company wanted additional medical records, asking for the results of previous chest x-rays and CT scans. When the provider did not submit those results within 1 week, remember the other day, they gave him a 4-hour window. The Medicare Advantage organization denied the request. The Medicare Advantage organization also cited internal clinical criteria that limited CT scans based on the size of the nodules and the receipt of chest x-rays. However, our physician, this is Health and Human Services Office of Inspector General, our physician panel determined that given the patient's history as a smoker, in the presence of a lung nodule already, the case contained sufficient clinical evidence to determine that the requested scan was medically necessary. A healthcare coding expert then determined that the request met all other Medicare requirements, including that the NCD, that's a national coverage determination for Medicare, for CT scans does not require prior x-rays or that the nodules be a specific size. They totally made that up in order to deny a $154 claim that could have revealed cancer. But why treat the cancer if you can't even find it in the first place? So they're saying this is a $154 issue. I'm saying it's a life-changing issue. Here's another one. 91-year-old had lower extremity pain that radiated into the upper leg, hip, and lower back, sciatica. That's painful. Back x-rays showed scoliosis and joint disease. What he's requesting? An MRI. The Medicare Advantage organization denied the service and cited internal clinical criteria stating that the patient had not completed 6 weeks of provider-directed treatment within the last 3 months. This is their criteria. However, our physician panel determined the MRI was medically necessary to plan treatment options due to the patient's age, symptoms, and results of a previous back x-ray. Further, the national coverage determination for MRIs does not state that completion of prior conservative therapy is needed before receiving an MRI. Now, this person, as I asked you to imagine, use your imagination, is in extreme pain, lower extremity pain that radiated into the upper leg, hip, and lower back. Now imagine this person sitting there in pain all over a $300 denied claim that could have resulted in treatment eliminating that pain. Thanks, Medicare Advantage, because this would not have happened if he was on original Medicare. This one is a 77-year-old that had a history of left shoulder pain. Anybody had that shoulder pain, like rotator cuff surgery and all that? Very painful. Anyway, had a history of left shoulder pain that had progressed in the last 3 years, gotten worse and worse and worse. The patient had received therapy and injections, but the patient's condition had not improved. I mentioned to you that one of the things that they like to do in the legal world, we call it a lesser included. They try to do all the step therapies to say, this didn't work, that didn't work, that didn't work. Okay, now we'll pay something. Well, they're trying to get out here of a $1,400 claim. So the Medicare Advantage organization, all he wanted, by the way, was a shoulder CT scan to see if he was eligible for an operation that could have helped him. A CT scan. The Medicare Advantage organization denied the request, stating that conducting this CT in this context was investigational and therefore not covered by Medicare. However, our physician panel determined that a CT scan was warranted and within expected standards of care because it could have more accurately assessed the condition of the shoulder and determine the type of surgery needed. Further, the applicable national coverage determination did not indicate that the use of a CT scan in this context was considered investigational. Investigational is some BS for them saying, we don't want to pay for this. We don't want to pay for this, so we're going to make up something that, oh yeah, this must be investigational. This is not medically necessary. Okay, sure. In this case, an 81-year-old had adenocarcinoma, yes, of the endometrium, a cancer of the lining of the uterus. And they wanted a CT of the chest, abdomen, and pelvis. Again, they want to know, is the cancer spreading? I don't know. So they denied this because they applied clinical criteria that are not found in the Medicare coverage rules. And they required unnecessary documentation. The Medicare Advantage company denied the request and cited internal clinical criteria that they just pulled out of thin air, which required information to support that the disease had spread to the cervix or that the tumor was advanced. Remember, if they don't diagnose it, they don't have to pay for treating it, or the 80% of treating it, leaving you holding the bag for the other 20%. That's what happens on Medicare Advantage if the treatment is fully authorized. In these cases, you can't even get to the test to determine if there's treatment necessary. However, our panel determined that the request was consistent with the applicable national coverage determination that original Medicare uses and had sufficient documentation to show that the CT scan was needed to determine the stage of the cancer, whether it had spread, and to determine the appropriate course of treatment for the beneficiary. Wow, they ultimately ended up reversing this one on appeal. Well, thank God. I wonder how much the cancer had spread. I won't go through a whole bunch of these, but I really want you to get the point. A 75-year-old had left hip pain and an x-ray showing mild degenerative changes. An exam revealed a limp caused by the pain. The beneficiary had tried non-steroidal anti-inflammatory drugs, wow, oral steroids, and immobilization with the brace. All they wanted was an MRI to find out what's going on. Cost involved, $275. Denied. The Medicare Advantage organization denied the MRI request and cited internal clinical BS criteria that required a beneficiary to receive conservative treatments for 6 weeks. You enjoy that pain for your 6 weeks, honey. It ain't worth it for us to pay for a $275. Go here. Here's some Motrin. Go take some Motrin and come back if you're still around and then we'll go ahead and see if we want to cover it. Our physician panel determined that an MRI was medically necessary due to the beneficiary's signs and symptoms, pain of hip changes and altered gait. Further, National Coverage Determination Guidelines do not require conservative treatment prior to an MRI. They don't. But Medicare Advantage does, because they want to be cheapos. After a long, exhausting day, it's kind of difficult to maintain your composure when you see this junk all day. An MRI is all that's requested in this particular case. 65-year-old had a history of chest pain. History of chest pain that radiated from to the shoulder and left jaw. What does that sound like? The beneficiary had a previous MRI showing 2 adrenal lesions of indeterminate origin, the largest of which was 1.5 centimeters. Are we talking cancer? Denied clause. The denial clause was the Medicare Advantage applied their own clinical criteria that are not found in the Medicare coverage rules. Would have cost them only $300 for this MRI. The Medicare Advantage organization denied the request after requesting and not receiving additional records, stating the beneficiary would need to wait at least 1 year. 1 year, that's all. Just wait another year for another MRI, given the size of the largest lesion. It's only 1.5 centimeters. The Medicare Advantage organization cited internal clinical criteria that allowed follow-up MRIs at 12 months for a lesion of 1 to 2 centimeters and 6 to 12 months for lesions greater 2 to 4 centimeters. A healthcare coding expert determined that the applicable NCD, National Coverage Determination Model, real Medicare uses, does not restrict the timing of MRIs based on a size of a lesion. Using the clinical information already in the case file, the physician panel from HHS stated that MRI was medically necessary to determine whether the lesions seen on the CT scan were malignant or not. Is it cancer that's growing? We'll never know, because the Medicare Advantage organization, you see, didn't want to pay $300. See no evil, hear no evil. If I don't know it's cancer, I don't have to be responsible for denying the treatment, right? 81-year-old, 63-year-old, 67-year-old, over and over. This one's interesting. The poor guy was hospitalized after a motorcycle accident, rib fractures, collapsed lung, an acute kidney injury. The beneficiary had a history already of heart attacks, irregular heart rate, diabetes, and COPD. And he just wanted to be discharged into a treatment facility. They said that he didn't need daily care from a physician. Oh my gosh. Which is clearly stated in the Medicare benefit policy manual that he would. Our physician panel determined that the beneficiary did require this level of care from a physician due to the complex health needs, medical history, and felt that the beneficiary could tolerate the level of therapy in an inpatient rehab facility. The Medicare Advantage medical director offered 5 days of skilled nursing care, but our physician reviewer judged that this alternative care would be insufficient for this patient. We covered that the other day from the lady's testimony, and I can play it here if anybody doubts me on it, that when you try to go to skilled nursing, that's when they're automatically going to give you the denials. And she tells the story of she had a family friend who had a fall and needed care to recover in a skilled nursing facility. She asked that friend, when they asked her what she thought, she asked them, are you on a Medicare Advantage plan or are you on a Medicare supplement plan? They said Medicare Advantage plan, and it went downhill from there. They had to pay out of pocket more and more and more and more and more. These are stories of real people. They're in pain, or they have cancer that may or may not be spreading. And what would you want to have? A plan that automatically approves what your doctor says is necessary, like tests to determine if you have growing cancer? Or would you like to have a plan that is based solely on the principal model of saving as much money as possible, what they call managed care? Well, they're not managing the care, they're managing you. They're managing the care that you're ultimately able to receive or not. I'm going to go to some questions. If you have any questions or comments, please put them in. This is a list of the ones that were reversed. They were reversed after they started asking some questions and poking around and that kind of thing. All they needed was an eye exam in this one case, $114. They were going to deny that to a 73-year-old lady with glaucoma. It just goes on and on and on. I will have this in the meeting notes, the description of this video when this thing's over. It's just sick And it goes on and on and on and on. These are the real people, not just some black and white study of saying, that's okay. Only 13% of those would have been approved by Medicare. Multiply that by how many millions of people? More than half of the country has now been led into Medicare Advantage plans. And I want to go into your comments that you've been leaving on the channel, but let me pull up what you've been leaving just now. Let's see. Somebody asked the question back here, going through underwriting. If you already have a Medicare Advantage plan, such as myself, for 3 years, you cannot go on original Medicare. So then what can you do? Oh, yes, you can. And I answer the same question every single day. So let me show you how you find it. Let me pull this tab up instead. This is a nice little handy dandy website called seniorsavingsnetwork.org. It's our website. Again, we're in 47 states. You click where it says Medicare Help, or you can click on the top where it says Get Medicare Help here. Either one you want to go to, click on that. And then it's a choose your own adventure kind of a thing. There's some ugly person there telling you what the options are. And the one underneath here says Medicare Advantage to Medicare Supplement. That's what you want to do. So you want to go from a Medicare Advantage plan to a Medicare Supplement. How do we do that? You click on the little button right there. Keeps jumping away because I'm streaming and it takes a lot of... Okay. When you go to that part of this page, so you may have figured out that the Medicare Advantage plan you were... And it tells you what the options are. It tells you what the process is. It goes through the timeline. It tells you don't do things in the wrong order or you'll screw up your coverage really bad. Let me see if I can show you this. See? All laid out there. And if you don't understand it, you can go back and watch it again. And you can watch it again, or you can fill out the form for us to help you. Our service doesn't cost you a dime. Yes, you can go from Medicare Advantage to Medicare Supplement. We've already helped hundreds of people do that this year. There are 2 time frames in which you can do that. Can I go back to the original thing? Yes. Let's see if I can skip down. Holy mackerel, we have a lot of these, 30 different ones. Okay, here we go. You can do this going from Medicare Advantage to Medicare Supplement if you wish to do so. From this period right here, October 15th through December 7th, you can add, change, or drop a Medicare Advantage plan. Don't do so if you're just going back to original Medicare and you want a Medicare Supplement. Talk to somebody who knows underwriting. Talk to an expert that can know the backwards, the in and the out of Medicare Supplement. Why do I say that? Because the reality is many agents, I'd say a very significant portion of agents in my space today are doing one thing. They're chasing you like a dog if you're 65 years old. If you're turning 65, and you all know what I'm talking about, you'll have a mound of paper. I've seen it on relatives' table, this thick, of people that want to help you with your Medicare when you're in your initial election period, your open enrollment period. Why? Because there's no underwriting. There are no health questions. And for me doing a Medicare Advantage plan, I'm going to get $600 or $700 or $3,000 for the under table money that they're trying to eliminate right now. See the live stream I did the other day on that agents hate me for right now. Thank you. You're welcome. So they're all chasing you at 65. That means that most of them don't know, they're hind end about underwriting. See, underwriting are those 20 to 30 health questions that you must pass in order to get approved on a Medicare supplement if you're outside of your 6-month period that you're new to Medicare. There are certain states, let's see, Connecticut, Vermont, drawing a blank, New York, Massachusetts, where you don't have to have anything beforehand. No health questions. You just jump on a Medicare supplement anytime you want to. Rest of the country, you have to go through health questions. You might ask that question of, let's see, what happens if I want to know, would I qualify through underwriting? Is underwriting hard? Well, I put this on here several thousand times. Let me put this on here right now. Go to our website called, and it'll guide you through it, seniorsavingsnetwork.org, get Medicare help, and you want to go through underwriting to see if you can qualify for underwriting? Yeah, that's covered in here too. Let's go to a Medicare supplement plan. It asks you the questions. Do you think you can qualify? Let's go through the qualification part. And if you go to seniorsavingsnetwork.org/underwritten, actually go through carrier health questions. Seniorsavingsnetwork.org/underwritten. Go through what those questions are. Do you think you'll qualify? If so, book an appointment with us. Here's our calendar. How easy is that? If you don't think you'll qualify, you can send us a message and we can help you with that and maybe figure it out, or switch to, if you have to, a Medicare Advantage plan that might be better suited for you this year. So yeah, you have options and we can help you with that. You can start at our website for information first before you have to contact anybody. Our service doesn't cost anything. So you have this period of time, the annual election period, where you can go back to Medicare Advantage. We need an underwriting decision before December 7th. Underwriting is now running a week to 10 days behind. So we're running out of time for this to happen. We already have quite a list of people that we need to get back to see if they can qualify, to ask them the health questions, get them on the calendar and write that application, submit it for underwriting and see if it gets approved or not. Is it worth doing all this junk? Yes, 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 it is. But if we can't get to it before December 7th, after December 7th, everybody in Medicare takes a little time off. We rest, we recuperate. They shut down enrollment for anything having to do with Medicare Advantage is why this happens. It starts up again January 1st. From January 1st to March 31st is another period of time where you can change your Medicare Advantage plan or drop your Medicare Advantage plan and go back to original Medicare. This works in much the same way. We would need to apply through underwriting for any time during this period when things are calmer. The underwriting is much, much better at the carriers. They're far more under control at this point. We apply for underwriting and we'll apply for an effective date on the supplement on the 1st of the next month. And then we wait to see what happens. If you get approved, then we can help you get a Part D drug plan to take the place of your Medicare Advantage. You would end up with a Part D drug plan tailored for you and a Medicare supplement plan, which means you go to any doctor you want to. Any doctor, any hospital, anywhere in the United States of America, as long as they accept original Medicare. That is far easier on the original Medicare route. I'll show you this larger so you can see it. On original Medicare, where your claims are processed automatically, they're just paid. Your doctor says you need something, it's just paid. The Medicare supplement pays the other 20% that the original Medicare doesn't pay, but there's no decider in here. That's a George Bush term. There's no decider in the Medicare supplement world. It's just automatically paid through crossover up at Medicare. They're like, hey, is there somebody sitting in that supplement spot? Yes, there is. Okay, let's automatically draft them for the other part of this 20%. Boom, it's done. Travel the country. Medicare Advantage, you're out of original Medicare. You're just not in it anymore. And the Part D plan that's in there is just a built-in plan. It's not custom tailored to you. So that question is so common. I thought it's important to spend some time on answering that. But yes, everybody's trying to crowd through right now. Everybody in the country. That's why we're way worse than normal on getting back to people. We're usually really, really good about it. Now we have a way where you can book right on our calendar, so that makes it a lot easier too. Let me go through some of these. Let's see. I've heard that too, that once you go on a Medicare Advantage plan, you can't go back. That's because you might have spoken with an inexperienced agent who doesn't know anything but Medicare Advantage. It sounds cruel. I'm telling you, that's a legitimate problem, is that most agents out there don't know jack shinola about original Medicare. Actually, let me show you this one right here. Where was it? Oh, can I find it? No, dang, I might have lost it. Till I thought couldn't go back, leave Medicare. I had no idea. Okay. Anyway, this is a pretty cool video clip about Medicare Advantage.
Attention. This is an important message about Medicare.
Hi, I'm Congressman Mark Bocan.
Hi, I'm Congresswoman Jan Schakowsky.
I am Congressman Ro Khanna.
And I'm here to talk to you about Medicare Advantage.
About Medicare Advantage.
About Medicare Advantage.
Yep, that's me. You're probably wondering how I ended up in this situation.
We want to make sure America's seniors know that private for-profit insurance, also known as Medicare Advantage, is not Medicare.
And that's why we've just introduced the Save Medicare Act.
Private health insurance companies get seniors to sign up for private plans rather than Medicare by calling themselves Medicare Advantage.
Medicare Advantage is neither Medicare nor an Advantage.
These plans seem cheaper or seem to offer additional benefits, but in the long run, they often don't cover the more expensive care that many retirees need.
So we want to stop private plans from calling themselves Medicare
and protect actual Medicare,
making sure seniors' care is covered for the rest of their lives by a program with the power of real Medicare.
So don't be fooled by the commercial gimmicks.
And don't call 1-800-anything.
Get the program you've paid for and earned. Remember, only Medicare is Medicare.
Only Medicare is Medicare.
Only Medicare is Medicare.
Yeah, it's true. And they sponsored a bill trying to get it changed. This is it. This is the one I wanted to show you. Check this out. Oh, get me off the screen. A Medicare supplement would have been the best for me, but no one told me about it when I first started Medicare. When I found out about the supplement insurance, it was too late. If I want a supplement now, I would have to qualify. And with my health condition, I would not qualify. I can tell you that many people actually would qualify. It's just that the first place that they turned said no based on a condition. Many of the conditions are time limited. Like if you've had cancer 3 or 5 years ago, you're beyond the treatment from that. You were hospitalized for something, or you had diabetes that was out of control. Now it's stabilized. You've been on your same medication with your diabetes. Your blood pressure has been stable for 2 years or more. You're good. There are a lot of conditions that people think are a lifetime ban from Medicare supplement that are really not. This is interesting. I wanted to show this one. Whoops, not that one, this one. It's been a long day. My New York Plan G went from $203 to $244. That's 20% different. And now $404 a month for 2024, doubling in 2 years. That's why I'm looking at Medicare Advantage. Somebody put you on the wrong plan, Mr. Paul. Somebody put you on the wrong plan. Probably somebody on YouTube screaming at you that 80% of our business is Plan G. 5% of our business is Plan N. That's because people know it more than we did and demanded that we write it. 80% of our business is Plan G. It's the wrong plan for a lot of people. If you're in New York, it's the worst possible plan to be on. If you're in New York, you could be on the high deductible Plan G. When you watch this back, I'll put it up there so you can see a link to my high deductible Plan G video, which talks about in New York. Let me share a little secret with you. It's just you and me and a couple hundred people hanging out. Here's the secret about New York, a state in which I am licensed. I don't make the rules. I just abide by them. New York State has a rule that anybody can get a Medicare supplement plan at any time without underwriting. That's why your rate is so high, because the people in New York decided on your behalf, it would be great if everybody could get a Medicare supplement with no health underwriting. What could go wrong? Well, insurance companies are not nonprofits. They're in the business to make a profit. And if they have to insure everybody, even those people that are chronically ill in the hospital right now, they have to take them if they said, you know what, I can get a Medicare supplement plan anytime I want. Maybe I'll just wait until I am sick. Maybe I'll wait until I do get cancer and then I'll get a Medicare supplement. It's called adverse selection. And that's exactly what's happening in New York and happening in other states too, because they want to do things for the people and just give them everything that they ask for. What's that old saying about you keep taxing other people until you, especially if you can use people's taxes to vote yourself a raise, the country will go to hell in a handbasket. Here's your secret for New York, since you've been waiting for so long. And for those that want to move to New York, here it is. Get a high deductible Plan G. It will cap your exposure, which means you don't have unlimited exposure to the 20% of the costs on Part B. Get a high deductible Plan G. You may have to pay $60 or $70 a month, and you'll have comprehensive care. Every time you go to the doctor, they will rebill your bill. They'll reprice it based on the Medicare discount, which is substantial. Then you'll be left with at the first part of the year, hitting your Medicare Part B deductible. Then after that, they'll pay 80% of all your bills. You'll pay 20%. If at the time you reach the max out of pocket, which is really what high deductible Plan G is, Let's say something catastrophic happened and you go in the hospital twice, paying over $1,600 each time. Boom, you've triggered it. You saved how much money throughout the year on premiums? In this ridiculous case of $400 a month, if you were going to pay that, 400 times 12 is $4,800. You would never come close to that. Most all people. But here's the little caveat. Here's the secret. Since you're on a high deductible plan G, if you do develop some kind of situation where you need a lot of health care, guess what you can do? You can walk down and do a happy little enrollment with old Christopher Westfall and get on your plan G. Flip a switch. Now, in the state of New York, they do allow people to discriminate against pre-existing conditions on Medicare supplement. That's trying to eliminate the people who slip in and say, didn't have a plan, now I'm getting a plan. If they find out about that, they can exclude that coverage for 6 months, but you can't have a pre-existing condition limitation if what? If the person had prior creditable coverage. So if your prior creditable coverage was 6 months until you made the change, whether it's an employer plan, individual plan, Medicare Advantage plan, Medicare supplement plan, major medical coverage with no gap of 62 days or more, then you don't have a pre-existing condition on any insurance because you've had continuity of care. So in New York, I highly recommend get yourself on a high deductible plan G. We can do that for you. Application takes about 5 minutes because there are no health questions in New York. Save all that premium aside for those 20% little bitty copays you're going to have on Medicare and for a rainy day. You call Chris back if you have something substantial that happens and you're going to need a big course of treatment. But we would never put you with a company paying $400 a month. Why wouldn't you just shop that with somebody? That's like free. You call them and say, hey, I got a rate increase, Chris. I need you to give me a better Medicare supplement plan. No problem. Let's look at the most competitive plan in the market. How long have they been in business? Who's their parent company? Do they know what they're doing? Is their customer service in the United States? You know, all the things that real agents know to look for after they've been doing this for a while. And then we'll put you on a much lower cost than just letting it go up every year and saying, why is my rate going up? Get a professional to help you because our service doesn't cost you a dime. Get on the right plan with the right carrier, and then let's work together if something changes for the worst. Okay? Don't be paying that $5,000 premium. Let's see. What can we get in our 70s? Pat, you can get everything in your 70s. Most of the 70-year-old people that I work with every day are super duper duper healthy, and it's just real easy. But the world is your oyster. It all depends on what your health is doing right now. Prior to retirement, these are not screened, y'all. So if you want to yell at me, just go ahead and put it in there. Prior to retirement, I was an RN case manager at a large hospital. We dreaded Medicare Advantage plans as they denied so much so much outpatient services for our patients. So many failed discharges and hospital returns. Man, if you look at our comments on the channel, now let me look at see what that's up to now. Last time I looked, it was like 9.2 million views. Comment after comment, doctors and nurses all saying the same thing. It's not a weird off the wall, random thing that's happening. What are the health questions they ask? If you go to seniorsavingsnetwork.org/underwritten, there it is right there. seniorsavingsnetwork.org/underwritten. You can see that. And you can see what those health questions would be. 9.464 million views. That's crazy. All right, let me look at some more of these. Let's look at your comments. Put them in there, please. Humana has a decent plan in. It depends on where. You just can't say as a decent plan in, John, because it's all different. It's all relative, and it's all depending on where you are in the United States. They're good in some areas. They're not so good in other areas. That's why it pays to have somebody who knows who's good in what area. What are their rate increases doing? I had somebody write to me the other day and say, is one particular company good in, and this is a comment on YouTube, are they good in Texas? They were good in Texas until they gave everybody a 15% rate increase and then rebranded themselves as a different brand. I don't like that very much. So we literally tell all of our clients when they call us and they say, hey, is this a good company? should I go with this company? Well, we know what's going on with the companies. We know when they're filing a rate increase in California, Nevada, Texas, and you're over in Virginia and you're like, hey, this looks like the cheapest rate today. Hold on there. Our nationwide reach allows us to see what's coming across, what's the wave happening with this particular carrier. They're losing their money. They're going to recoup that at the next possible opportunity. So you need to watch out for that. The only way you can get that is from experience. Let's see. Good advice, Chris. Thank you. I will call. Good deal. Our number should be on the screen, but it's not. And if you call now, I guarantee you it's going to be a long wait just because we're in the middle of the season as I write this. Is it true that in Washington State, I can switch from an Advantage plan to a supplement at any time? No. I had a comment on here. Somebody was really mad because they thought that they were told that in Washington State, you can get a Medicare supplement with no problem whatsoever. That's not true. It's a half truth. If you're on a Medicare supplement, you can change it. If you're not on one, you have to get on one. How do you get on one? That's the only time that we have health questions in Washington State. So we had somebody call in here and they applied through the health questions. They were denied because of uncontrolled diabetes, and they're mad at us and left me a comment on YouTube that I replied to, citing the Washington State law because they said that you don't know what you're talking about. I called Medicare and asked them about the Medicare supplement in Washington State, and Medicare said that they can't be denied for Medicare. That's true. If you want to leave your Medicare Advantage plan and just go to Medicare, you can do that. You'll only be responsible for 20% of your costs on the outpatient side, which is Part B. You can do that. You can do it now. You can do it in the first quarter of the year. You can go back to original Medicare. What we're saying is, if you want protection from all those costs, if you want a Medicare supplement plan, you have to go through health questions. In certain states, Washington is not one of them. So if we can get you on one, then yeah, the world's your oyster, and you can change all you want to in years in the future. Let's see. They need to make Medicare cover 100% and eliminate the need for supplements, and then nobody can afford the Part B. That's what happens. There's always a give and a take. And if you get something free on one end, they'll take it from you on the other end. There are not enough taxpayers to make the healthcare free. Would you recommend AARP, United Healthcare, Plan G in the state of Florida? I would generally not recommend Plan G at all, regardless of who it is. Regardless of if they have a vanishing discount that they call a disappearing discount that they call not a rate increase, but it's already built in. But I digress. In the state of Florida, a high deductible Plan G strategy is warranted, especially when you compare what a Plan G would cost. That's just the wrong plan for Florida, really. A Plan N or a high deductible Plan G in Florida is what I would recommend and what I put my family on. And then Michael answered your question. I didn't say it. I've become disabled at 45 after an accident. I have to shop Medicare Advantage plans until I turn 65. They denied me for a supplement because they can hold pre-existing health conditions in Arkansas. Yeah, every state is different. That is a problem. When you're under 65, you don't have all the rights and remedies available that you have in other states. I have a website on that explains this process. It explains what states we could help you with on a Medicare supplement plan. In the states where they do have Medicare supplements available by state law, because Medicare supplements are on the state level, not through Medicare.gov, on the states where they are available, there are just a few that don't treat you as if you're under 65, they treat you as if you're like a 99-year-old person. That's just horrible. So we know what those states are, and it's right there on my website. You can go to that website and you can get help on that. Or if you do have to go on your on a Medicare Advantage plan, you can shop it yourself using our tool, and then we can be involved if you have trouble in the future. It's called MedicareAdvantageNearMe.com. It's a self-enrolled site. There you can choose to get with us, or you can go do it yourself and choose your own adventure and do your own sign up. Whatever plan you sign up for Medicare Advantage or Part D, whatever plan you sign up for closest to December 7th, let's say you sign up today and then you change your mind. You sign up tomorrow, then you see something else and then you change your mind. The last one in is the rotten egg. No, the last one in is the one that goes into effect on January 1. So you can look at that as a resource. Let me go back in and see what else we have here. I'm sorry about your situation. Isn't it possible that Medicare can deny a claim? Yes, and they're trying more and more to catch Medicare fraud. They just arrested an insurance agent and some other folks on Medicare fraud last week. I didn't bring it to you because there's too much other stuff going on. But yes, it is possible that they can catch and deny a claim. I'm in New Jersey and have a Humana plan in, and they've increased my premium for 2024. Not a lot, but an increase just the same, which makes me wonder how often they can do this. In most states, on most plans, they can change your rate one time per year. And there are two factors in that. One can be your age. They can't single you out based on your health conditions, but they generally will take everybody in that same risk pool and go to the state and say, we've lost money on this group. We need to increase our profits so that we can maintain our integrity of being in business. And so they'll ask for a justification and a rate increase. Sometimes they're approved, sometimes they're not. But anytime you get a rate increase, that's the time you should compare the market, because all the plans are the same. The difference is the premium that you pay. And if you have a national payer, they have been in business for 20 years or more, they have onboard American customer service people, then the rest is just how much you're paying, because Medicare in Washington sends that amount to them to pay automatically through crossover. So you should shop that every single year. If your agent's not even affording you the opportunity to shop it, you might want to find another agent. We'll send our clients a voicemail, an email, and then try to call them to get everybody to review their plan, especially if we spot that they've obtained a rate increase or it's going to be coming to them. The retired cop, thank you, sir. Appreciate that. I want to share with you this story that just came out from my friend Cheryl Clark. She's a contributing writer to MedPage Today. This came out just hours ago, and this is very interesting. If you want to know all you want to know about Medicare Advantage or not, just see what the doctors are saying. Just what are the doctors saying about Medicare Advantage? And this just came out, I mean, literally just before I went live with you here tonight. And I want to share with you the text of this. American Medical Association delegates trash AI bots, Medicare Advantage, and inexperienced politicized ALJs. Read this part right here. It says, this was the American Medical Association House of Delegates interim meeting, and they went over what they're going to be fighting for this coming year. Let me skip down to our fun part right here. Medicare Advantage. One of the more animated discussions involved a resolution that would mobilize doctors to fight fast-moving privatization of Medicare through Medicare, quote-unquote, Advantage plans, which speakers criticized as not really providing an advantage over fee-for-service. Say it ain't so, Joe. Dr. Choi, he's a doctor. Obviously, that's why I said doctor. Speaking for the Section Council on Ophthalmology, supported a resolution that would have doctors tell their patients not to use artificial intelligence. That's not the right article. It just screwed the whole thing up. Dr. Daniel Choi, a spine surgeon from Garden City Park, New York, who spoke on behalf of the private practice physician section, was especially upset about Medicare Advantage plans, which now enroll more than half of Medicare's 66 million beneficiaries. He said, it's a game. Every single surgery is a prior authorization denial, resulting in a peer-to-peer call, another denial. And that patients' surgeries get delayed 3 to 6 months, he noted. And we already saw evidence of that before, that the Department of Health and Human Services found. Choi said most of his Medicare Advantage patients tell him that they are surprised. Their agent didn't tell them this could happen. What? What's this going on? They say, I thought this was the better plan. That's what my insurance agent told me. No. Those honest agents would never tell you that that's better than original Medicare. The resolution that they proposed directs the AMA to educate patients about the threats to Medicare system from such plans and address the $23 billion in overpayments that Medicare Advantage plans will receive in 2023 alone from Medicare funds due to plans allegedly upcoding risk scores, an estimate of the patient's level of health and sickness, to garner higher reimbursements. The proposal asks the AMA to urge the Justice Department to prosecute those found complicit in fraud. The resolution wants Medicare Advantage plans to be renamed as we just saw those Congress people, alternative private health plans, since many argue they are not Medicare Advantage plans. And to that end, let me see if I can show you this. Go on the window. There we go. Let's see here. Right here. Can I show it? 1 second. We get it to work. It's live. And this is what happens when you go live. Share with the entire. There we go. This just came out 10 days ago. This is a whole bunch of Congress people. Look at them. Whole bunch of members of Congress. What are they writing about you and your Medicare? Did your agent share this with you? Have you heard about this yet? Pretty interesting. Let me zoom in and show you what these Congress people are trying to do to your Medicare. To the Honorable Chiquita Brooks LaSure, Administrator of CMS. Dear Administrator Brooks LaSure, we appreciate your efforts to improve consumer protections in Medicare Advantage program, particularly with respect to the Center for Medicare and Medicaid Services' new prior authorization requirements in the 2024 final Part C and D rule. We remain concerned, however, that the new rule might not adequately address Medicare Advantage plans' increased reliance on artificial intelligence or algorithmic software to guide their coverage decisions. I did a video on that, artificial intelligence, and when you're watching the replay, you can see it linked up above. We therefore urge CMS to increase oversight of these tools used by Medicare Advantage plans. As you are aware, this is for those in Rio Linda, those agents of that are out there commenting that say it's the same benefits as original Medicare. You get all the same as A and B, like the commercials from what's his name, and then the other commercial. As you are aware, Congressman said, most services and items in traditional Medicare are not subject to prior authorization. Instead, claims for services rendered or items provided are submitted to Medicare administrative contractors to process payment. Bam! It's just done. Conversely, on the other side, what's the difference? Medicare Advantage versus Medicare Supplement. What's the difference? These Congress people are saying it right here. Conversely, there is widespread use of prior authorization in the Medicare Advantage program, particularly with respect to costly services. It's going to cost you something? No thanks, denied. The Department of Health and Human Services, Office of Inspector General found, quote, widespread and persistent problems related to denials of care and payments in Medicare Advantage. And in the new 2022 report found that among prior authorization requests denied by Medicare Advantage plan, 13% of those met Medicare coverage rules. In other words, those services would have been approved for those beneficiaries under original Medicare. Now, my new agent friend that's brand new to YouTube is telling you that 13% of 66 million people, or 33 million if only half of them are on Medicare Advantage, is not a real big deal. Really? What are those numbers? In recent years, problems posed by prior authorization have been exacerbated by the Medicare Advantage plan's increasing use of AI or algorithmic software managed by firms such as NaviHealth to assist in their coverage determination in certain care settings. Watch the Congress testimony on that. It's just sickening, including inpatient hospital, skilled nursing facilities every time, and home health care. Advocates and the media report that the use of such software has led to coverage decisions that are more restrictive than allowed under traditional Medicare rules, as well as more frequent and repeated denials of care. As noted in these reports, despite evidence to the contrary, Medicare Advantage plans and the firms that use these tools assert that they are not used to make coverage determinations by merely providing guidance. What a bunch of junk. So anyway, they want this to come out, and this is just prior to what I just talked about the other day, the new proposed rule for 2025 in Medicare Advantage, which would require, if approved in its entirety, that Medicare Advantage plans disclose every July all this prior authorization crap. They want these plans that require Medicare Advantage plans to report prior authorization data, including the reason for denial by type of service, beneficiary characteristics such as health conditions and timeliness of the prior authorization decisions. That would be nice. We'll see. Now, this coverage, this rule is proposed to start again in 2025. And we have until January where you can opine. Please see my last video where it has the QR code, the address, and everything, where you can let your thoughts be known if you want this to be implemented or not. I don't know why it just automatically.
Trying to stay on a budget and finding it difficult.
Right.
Coverage as
Original Medicare. That needs to clarify.
Wait, what's the difference again?
Because it's already a rule that Medicare Advantage plans must cover the same as must provide at least the same benefits as original Medicare.
That is exactly my point, that it's not a problem with rules, it's a problem with compliance and enforcement. In other words, the Medicare Advantage plans basically have been flouting their obligations under existing law without a new rule, correct?
Absolutely correct, yes.
And a new rule is only as good as their being willing to change their real-world practices.
Yeah, that's what's happening. I want you to see these as I read some of your comments here and see if we've got anything that you would want answered while we're here. My Aetna plan went up 3%. Would you ship it? No, not necessarily. I think that's a really great rate increase. What's the difference between Medicare Advantage and supplement? Bernie? Been talking about that a little bit tonight. Been just a couple times on this channel. I really encourage you to watch this channel more. Two ways you can go with Medicare. You can go original Medicare where everything's paid. See this busy little claims person down here just paying the claims automatically? That's original Medicare. You have no network. You have no restrictions. You have no prior authorization. You have no referrals. You have nobody's permission to get. You go to any doctor, any specialist, any treatment center in America that accepts Medicare. That's your network. There is no network. Or you have Medicare Advantage that's losing hospitals, losing doctors, requires prior authorization for anything that costs anything, denies care routinely for skilled nursing using artificial intelligence that tells them, guides them to how long you deserve to be in there before they kick you out, and then denies things on a regular basis. That, my friend, is the difference.
Kind of bait and switch plan. They bait people to come in with the promise of providing more, but in fact, many of the beneficiaries receive less, correct?
Well, I certainly wouldn't put it that way.
Of course you
If
wouldn't.
a senior has original or traditional Medicare, they can expect to receive up to 100 days of coverage for their stay with no hassle. If a senior has a Medicare Advantage plan, however, they can expect to receive a denial well before their doctors even say they're ready to go home. Now, these are not uninsured individuals. These are individuals who have chosen and paid for a Medicare product that was heavily marketed and aggressively sold to them. They're not getting the coverage that they paid for, and they're met with hurdles at every turn.
That was clear enough. That's the difference. What happened to MSA plans like Lasso? They didn't make them any money. They had to go out of business. Have you ever heard of something being too good to be true, where you can go to any doctor you want to, have free money, and get the money from Medicare Advantage plan and give it to the senior? That's what those plans were. And I'll pat myself on the back because I don't do that very often. I'm really the most humble person you'd ever meet if you met me in real life, if I wasn't fired up about people being screwed on the YouTube. I was offered to sell that plan for the last 3 years, and I just thought there's something not right that would be under the umbrella of Medicare Advantage, but act like a Medicare supplement. But no guarantees on whether things would actually be paid or if the doctors would accept it and that kind of thing. It turns out I was right, and I'm glad we didn't get our clients involved in it. Beep boop, I love that. Your agents are really blessed to be working with someone like you. There's really no reason why seniors on Medicare should be put through this. Absolutely true. Tom says, if there's not enough taxpayers to pay Medicare have Medicare pay at 100%, I would gladly pay more for my Part B deduction out of my Social Security. I'd rather have my money go to Medicare. Well, you can do that now. If you just take your rest of your Social Security, put it in a piggy bank for the other 20%, then you've got your 20%. If you look at the Medicare trustees report, my gosh, I want to bring you that video. The guy that was nominated by the administration, I won't say names or parties, to be a trustee on the Medicare Trustees and Advisory Board that works for a Medicare Advantage plan and was asked, if I was going to stay here all night, I'd pull it up for you right now. You've got to come back and see that video. It's the fox running the hen house. Incredible. But anyway, so if you want that, but the point is, Medicare Trustees report comes out every year, shows the true cost of Part B. I've not seen it in a couple of years, but it's way more than the $174 that you'll be paying this year. Way, way more. It's subsidized already by the current workers that are out there. So that's about it for me. I'm going to go home. I really, 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 really highly encourage you to subscribe to this YouTube channel, because there are some updates coming out on Medicare that you want to be aware of, and we can help you. Just reach out. From a world of law enforcement trying to help people out of scams to a world of insurance trying to help people out of scams, I'm Chris Westfall, and I'm very thankful for your time and your attention, and for all the people, thousands of people have been sharing our videos. The one from 2 videos a day now has over 250,000 views on it. So thankful and so humbled to be here, to be able to bring you information about what could affect you or somebody else that you know on Medicare. So please subscribe to the channel. Please like this video. It helps other people to see it. All the video clips that I've been compiling all day while running and putting out fires and answering questions during the day. Hopefully it means something if we can get the message to somebody that's making their own decision about healthcare. Thanks so much for watching. God bless y'all. Have a great night. Got to go pick up my daughter now. Bye-bye.